Well, it's good news.
Yeah.
Especially for you.
Oh, yeah.
So,
I'm gonna bring it to order. Now we can officially start.
thank you very much, Mr. Chair.
We'll call the meeting to order. We have any staff or trustee additions or deletions to the agenda?
Mr. Kennon, are you going to address the Palms agreement now or wait?
I can address it now. We are still back and forth with Ms. Anita. So I'm requesting that, be either tabled or put on to the next monthly meeting. We're still going back and forth on language. We should have it finalized then.
Okay.
Still addressing concerns and stuff that were brought up at the prior meeting. I think we've had, couple discussions, so want to just, if that's agreeable, we should have that finalized, for the March.
Yes.
Any additional items you're aware of, Dale?
No, staff has no other additions or deletions, Mr. Chairman.
Chair, I make a motion, we adopt the agenda with the change of removing the discussion and possible action for the approval of the construction and operation agreement with Palms Medical Group.
I'll second it.
Motion and a second. All those in favor?
Aye.
Motion passes. We'll move on to public comments. Mr. Ford, do you have any general comments or do you want to wait for the?
Well, I guess my question is, did y'all just table the Palms medical thing for tonight? Or it's on the agenda, or are you gonna discuss that or no?
No,
Not tonight. We didn't have enough time
So
to.
if we want to discuss anything about that, we should do it in public comment?
Yeah, yes, sir. That's what, this actually would be the best time. Yes, okay. Yeah.
So, my name is Rocky Ford, I'm resident of Fort White. And I addressed y'all last meeting about the agreement with Palms and you know, I encourage y'all to keep an open mind about this before you make a decision. You know, your mission is to provide primary care for the whole county. Not just City of Lake City or not just in town. So I met with the health department last week. And basically they can provide primary care at their facility across the street. And we have a facility in Fort White right now that's available to do primary care in. The county maintains the building. We've maintained the building for several years. And used to, the health department provided primary care 2 days a week in Fort White, 3 days a week in Lake City. The funding for that went away at some point with the state, so they had to get away from it. But I have Miss Diana from the health department here. She'd like to speak tonight also to y'all. But I just want to hit the highlights before y'all get started. So they can provide a doctor, a nurse, and a secretary, and OBGYN care, and midwife services. There's no OBGYN care in Columbia County right now. Palms is not going to provide that. Been brought up before about X-rays. They can do a contract. Before they had a contract with LSHA Hospital to do X-rays for them. They assured me they could do a contract with the medical center over Lake City for X-rays if they needed X-rays. And I just add, most doctors' offices today do not provide X-rays. They use the outside source. So, you know, for $380,000 a year, they can provide this service. For the money you're talking about spending at Palms, that would pay for this service for over 12 years. So, you know, I would let Miss Diana come up here and tell you exactly what they can provide, what they can't. I don't want to get into her business on that. But I just asked y'all, before y'all do this deal with Palms, if you're insisting on spending $5 to $6, $7 million, build a facility somewhere between I-70, around I-75 and 47, just build a new facility. And put Palms there, that way you're kind of in between Fort White and, or the south end of the county. I mean, we have Ellisville down there, we have to have most of your residential constituents live in the south end of the county. So you really need to provide services to that area also, if you're gonna provide this, especially if you're gonna spend millions of dollars to do it. So, at this time, I'd ask if y'all let, Ms. Diane from the health department come up and talk to y'all.
Thank you. My name is Anna Duquesne, I'm the health officer here at the Columbia County Health Department. After speaking with Commissioner Ford last week, he'd asked me to come and do an educational piece of the services we have to offer at the health department, as well as what we can offer, if we have the availability to do so. So currently we provide women's services, that's your typical pap smear, STD testing, we do family planning, like birth control methods, we also have HIV services, like test and treat. We provide dental school-based sealing program as well as pediatric dentistry. We have WIC nutritional program, we have Healthy Start, vital statistics, which is the birth and death certificates. We have disease surveillance, we have public health response for like special needs shelter for emergency duty. And we also have EH, the Environmental Public Health Department. So what Commissioner Ford and I had spoken about was that with the funding, with any funding for primary care, we could potentially do 2 to 3 days in Fort White and the rest of the time in Lake City to offer primary care. So what that would look like as a physician, this total salary with benefits would be $223,040. For an RN would be, this is again salary and benefits, $96,824. And the senior clerk, which is $62,064.96. So the salary and fringe comes out to $381, $381,000, yes, $928.96. That's salary and benefits for those 3 positions alone. There would be some one-time cost for something to set up in the Fort White clinic, but it wouldn't be more than $6,500, and that's required for IT in order to handle an influx of patients and the amount of traffic we'd get in that building. But other than that, we would be able to do it. We currently have a contract for x-rays with Company Care with HCA. So we have a standard fee for the viewing of an x-ray or for 2 views, depending what the physician asks for. So in the beginning, first total year wouldn't be more than $390,774.71 after the one-time cost total. And then ongoing would decrease just to the salary dollars, basically. That's basically all it would take to offer primary care in Fort White and Lake City.
Jeremy, I got a question.
Yeah, go ahead. Mr. Ford.
Hamilton County, y'all do primary care.
Yes, we do.
Who helps fund that?
So we just offer primary care with the community. So the commissioners and the hospital authority there also helps fund it.
Okay, so it's a joint effort.
Correct.
Okay. And is it 50-50 or?
No, hospital authority is much smaller there, so we get 33,000 over there, and they help fund a lot for the prescription program.
And so the county does the rest?
The county does a lot, and the state as well.
Okay.
And we also have contracts with health insurance to be able to charge them for those who are insured.
Okay. Just out of curiosity, has the county ever approached you about doing primary care? County commission?
Here, since I've been here, no, sir. I've been here since I've been interim since October 23 and then appointed in March of 24.
Okay, thank you.
Any other questions?
Well,
Yeah, you just opened my eyes to something. Tell me how you qualify for services if you provide a primary care.
At the health department, so we have a sliding fee scale up to $0. So if somebody can't pay their bills, if they're injured, uninsured or underinsured, we still serve them. We're the only person that would be able to provide completely zero cost.
Okay, and you said you accept insurance,
Correct.
any and all?
So with private insurance, we would end up doing contracts with insurance companies. We would do negotiations right now, we don't have them in place. So we're out of network right now because we don't offer primary care.
So it would have to be dependent upon each
Correct.
particular,
Mhm.
whether they would allow such or not. Okay. And the fee schedule that you just stated, I don't have a copy of that. Do you have one that you can provide
Not
us?
on me, but yes, they're posted in our health departments. They're statewide, the same fee schedule. They're the same for all programs are not family planning.
I'm sorry, what I'm.
Oh, the
when I-
cost?
Yeah, total
Oh,
cost.
I have just my notes, but yeah.
Oh, no,
I
no,
can share
no.
that.
If you can just get it to the office here, I'd like to look at that too. And, I don't have any other questions.
So how often is a clinic open in Fort White?
Only 2 times a month. Right now, it's on 2 Wednesdays a month, only in the afternoons, and it's only with a registered nurse. So basically, a nurse from Lake City comes over there. It's not really being utilized. We would, if we were ever to do primary care, we would do a whole marketing, a whole promotion, it would be revitalized. From my understanding, historically, it was a really, high traffic clinic, several years ago. And then with COVID, it kind of decreased and then just hasn't revitalized itself again, so. I would like to,
And I think Mr. Bullard asked you a question about Hamilton County.
correct, yeah.
Is there any other county that,
Offer primary care?
yes,
Oh, yes, there are several. Alachua does as well, I know. Dixie is starting to offer primary care. They're just starting it right now. So they're in the works of trying to figure that out, how that would look. But yes, there are several.
but Suwannee County,
Swanee, I don't believe.
Baker, Union.
Baker, not 100% sure. I
Okay.
think they may. Union and Bradford are unique because they are FQHC facility as well as Department of Health.
What is that?
Yeah.
Federally qualified healthcare center, what Palms Medical is, or AZA and Putnam, things of that sort. They're FQHC, federally qualified healthcare centers. We're big on acronyms.
Federally qualified healthcare centers.
Correct, yes.
Does that equate to primary care?
No,
Help
that
slow
just means their
people in
source
the
of
group.
funding. They're just federally funded.
Okay.
Most of them also get the Health and Human Services grant too.
Okay, I would like to ask, you've spoken of primary care. What about other services?
That we offer at the health department. So we have the women's health, HIV currently, the STD testing. We also have WIC, the birth and vital statistics. We do emergency response. We also offer Healthy Start, which is a home visiting program and provide educational to parents and families with children under the age of 3, from prenatal to age of 3. And then we also have environmental health.
When you say women's
And we have
services,
dental.
when you say women's services, what do you,
So we do pap smear, we do the breast exam, we do birth control. Things of that sort, female health,
you don't do anything with obstetrics?
not currently. So that was another thing that Commissioner Ford had, and I had noticed here in our county, we've had 3 providers providing OBGYN care. As of the end of last year, we're down to 2. One of our main ones here decided to drop off from OB and just do gynecological services between Alachua and Lake City. And so we only have 2 providers here. And we don't have a birthing hospital, so we're starting to become a desert for OB care. And a lot of the rural communities is. So I have reached out to UF. I should have a meeting in the next 2 months to schedule the possibility of bringing back the MIC program. Again, acronyms we love. Maternal and Infant Care Program, which is basically they'll bring the UF providers here to the health department and help provide OB care. So it won't have a birthing facility, obviously, but at least it'll help mothers have prenatal care here. And they could see their doctor here once a month to help reduce the transportation issues of going back and forth to Gainesville. And then in their 3rd trimester, when they have to go weekly, they'll have the provider here. So it helps establish care here in Lake City. So I'm hoping I can start negotiations with them. I did see my colleagues in Bradford Union currently has that contract. And right now they're only paying $120,000 for every 3 years. So it's only $40,000 a year for OB care, which is to me a fantastic deal. For moms and babies in the community. So that's something I'm also trying to see what I could do in the community to bring back OB here.
check and see if there's any more comments.
Do that dentist.
I was not prepared to have question and answers as it wasn't on the agenda, so.
Flat footed, but we started off, I was like, well, we're gonna talk.
I mean, I think if we're gonna, I mean,
We put it on the agenda for,
should we put out another RFP? I mean, you
No,
know,
no.
we could go, I mean, we could start the whole process over. I don't know. I'm good. I don't have any questions.
okay. Okay.
Good night. That's what the response was in 22.
Sure.
Can I add one more?
Sure.
So. So I've lived in Fort White pretty much all my life.
Yes.
So when my kids were in school. If they wanted to play sports. They had to get a physical. Every kid in Fort White went to the health department to get their physical. At the most, we had to pay like $25. I was talking to some kids the other day, even playing Little League now. There's nowhere in Fort White or nowhere in the county that offers physicals anymore. From what I can understand, the school, when I was in school, they had the doctor come to the school. At the beginning of football season, basketball season, and everybody on the football team would get a physical, but they don't even offer that no more. So now, it's a lot of kids, it's $100 or better to get a physical now for the kids to play sports. Not only that, they have to buy their uniform and everything, all that was provided in school. So this might even help the sports program in the school, because it will cut down the cost of a physical, because the kids can go to the health department to get physical. Basically, for free or $25, $30 or whatever, where instead of $100, $150. But, this would be a great service for everybody, even school kids in the county. There's a lot of kids want to play sports, they just can't afford to play sports. Their parents can't afford to play sports. And I think this is a great opportunity to help those kids too. I'd encourage y'all to think about this here, and try to make the right decision on this. I think it's a lot better plan than putting up millions of dollars and then having to come back and pay for any lost revenues for 3 years after that, up to $800,000. I mean, like I said a while ago, if you're gonna spend that kind of money, build a new facility, centrally located somewhere. I mean, this is kind of hard to get to for a lot of people, especially in South End County.
Thank you, Mr. Ford. Yes, sir, Mr. Bill.
We'll bite for a moment on that. I don't know, might be a legal question. I think we'd have to be a little careful. Our mission is to provide care for the indigent of Columbia County. So I don't know that we could just say, here's all this money to provide physicals. And I think it'd be great. It's a needed service. Whenever I was in school, which I feel like was a few years after Commissioner Ford, they still did the same, they would come to the school and do physicals as well. And I know that has changed, but I think we have to be careful. And, something else, I'm not sold 100% on the Palms thing, as noted in our last meeting. And one of the reasons why is, I think that we should offer, if we do the deal with Palms, that it should be for Columbia County residents, no matter what facility they go to, whether it be this one, West 90, 5 Points, High Springs, Suwannee County, Trenton, whatever. I mean, I was in Trenton today. If I got sick while I was in Trenton and went there and I was on that sliding scale, I think it should be open to Columbia County residents, as long as they can confirm that it was a Columbia County resident that matches and meets the criteria to be on the program, that it should be paid for. So I think that would be a benefit to having Palms, is having 13 facilities, 14 facilities available. And the $5 million is more than just providing care. And that's multiple positions, multiple providers, nurses, staff, x-rays, pharmacy, there's a lot more to it than just primary care
Yeah,
as
just
well.
primary
So
care.
that's my 2 cents.
Appreciate it.
So Mr. Bill, what does, Mr. Brandon? I was just curious to what
Mr.
Palm
Ford,
provides.
this is public comments, sir. I'm
Yeah,
gonna finish out the public
yeah.
comments. Ms. Limley, you're next in line.
Thank you very much. I like the idea that Diane, to Kate, not sure if I got her last name right, but I think that sounds really good for the authority to provide the expense to have a doctor, a nurse, and a clerk. But the other thing, put your thinking caps on, because back on September 9th, 2024, this board, it's noted in the minutes. Comments by all trustees, Mr. Beal, Mr. Kennedy, Chairman Douglas, and Bullard are in favor of giving no authority funds to any entities interested in the hospital accounts. So if you take that into consideration of what you guys said, Palms does not get money. And too many times this board has done do-overs and do-overs. But this is in writing, and I know Palms is not on the agenda now because it's been delayed. But I will bring this up again. And the idea of having a health clinic in Fort White would be very good. I know when my kids were in school, you know, the ex-husband, now deceased, did physicals. And if the parent could not pay, we personally would pay, besides providing uniforms for kids that wanted to participate in sports, because sometimes there's a good kid, bad parents, no funds, and that little soul is lost. Thank you very much.
Thank you, Ms. Lemon. Mr. Foreman, any general comments? You want me to, just on yours?
Yes.
Okay.
I forgot one thing.
You- 30 seconds.
On the distribution of buildings,
Yes, ma'am.
this building here would be a great location for the court. And I hope you guys are the judicial circuit, so I think you guys need to take that into consideration as well. Thank you.
Thank you, Ms. Lemon. Mr. Lilker. As usual, you circled the free world, so
I did that.
I'm going through.
My wife did that. Thank you very much, Mr. Chairman. It's nice to be here this evening. A couple of things. First, I'd like to commend Commissioner Ford for picking up on this idea, which I gave to everybody in the county. At the last meeting, that the Department of Health should be doing this. Barbara and I did go to speak with Senator Bradley's representative and discussed this. We presented 5 questions. Mr. Ford got a copy of this. And you got a copy of this.
Is that what this is?
No, this was a copy that I told you on the phone that I emailed you.
Yeah. Okay.
And it was 5 questions like you would do in a court of appeals, but this was just questions, and it said, had the hospital authority done a needs assessment to determine the need for a primary care clinic on the authority property? The answer was no. Haven't done it yet. So once again, this may be putting the cart before the horse. And Ms. Shays was taking notes and had a copy of this. The next question is a $5 million investment of public funds for a primary care clinic 500 feet from the Department of Health justified? And I think that's a question that this board would have to answer. It wouldn't seem that. It says the Department of Health is set up for primary care delivery. It's estimated the cost would be in the $300,000 range for a doctor and an RN. And since that time, the Department of Health has added somebody else. I was hoping the head of rural health systems for the health department would be here tonight, but he's tied up in Jacksonville. And the remark from the Senator's aide is that if the health department is behind it, that would be good. And to consider when the hospital authority deciding what to do with this money. I would also point out that that was not mentioned by Mr. Ford or anybody, that the $300,000 that it would cost to provide care is basically free. For two reasons. Number one, you pay the health department. The health department's not free. They've got a sliding scale. So if you can't afford anything and you're totally indigent, it would be zero. If you have health insurance, you would get that. If there's another means to pay, the health department would get that. So it's not free. So that $300,000 may come down by $150,000. The second element of that is the hospital authority brags that they're a keeper of good public funds. You have $20 million in the bank. So the interest on the bank money would clearly make up for the deficit in the health department funds, plus more. Plus maybe they could provide more services. The question that you guys discussed when you decided whether to put a primary care clinic in had nothing to do with indigent. You put in a primary care clinic. And if the health department provided those services before, and Ms. Duquette was not there at that time, so it's hard for her to explain something when she wasn't there. But you've heard Commissioner Ford and everybody that I've spoken to about this, and nobody is not in favor of it, is that when kids were growing up, this is where they went, to the health department. And you don't have to reinvent the wheel. You could do this. The health department cannot lobby for money. But they're right across the street. They don't have to lobby for money. All you have to do is open your eyes and you can see the health department from here. Thank you very much, Mr. Chairman, for the extra time.
Thank you, Mr. Rook. All right. So I got some additional public comments. I haven't heard once or twice. All right. Thank you, everyone. Public comments wrapped up. On to approving the consent agenda. Motion to approve.
Mr. Chairman, I move to approve the consent agenda.
Second. I have a motion and a second to approve the consent agenda. All those in favor, say aye.
Aye.
All right, motion approved. On to our new business. There's a request for approval for the new renewal of the U.S. Treasury notes. Let's see.
All right, I'm ready when you are.
Yes, sir. Please.
All right, Mr. Chairman, trustees, in your agenda packet, you have attachment A1. As you are aware, we invest the cash of the authority in U.S. Treasury notes. As you can see, we have a maturity date on a block of those notes coming up this month on the 15th. At your request, you requested that we bring each of these renewals back to you where you could review them prior to them being renewed. What you also have on the attachment is it would appear that the rates that we will be getting when we reinvest will actually be a little higher than what they were from the initial investment. Treasury notes have been good to the authority the past year and a half. Based on what current rates are, I don't see that trend changing. I don't think Mr. Powell sees that trend changing. And so we are asking that you authorize staff to renew. It'll be a block of money close to $2 million. And I say close to because it never works out even money. Depends on what the notes are trading. And you allow us to reinvest that block in a new treasury note. And I'll answer any questions you may have.
And this is the one for February 15th we're talking about?
Yes, sir.
And we're talking about a 12-month?
I think so. That's going to be my recommendation. I really didn't talk about maturity with Richard, but I don't see why you would do it less than the 12 months. I think that's fine. I think it gets the biggest yield for the authority. And I don't think it will create a problem in terms of our financial needs up to that point.
These
24 months. Oh, I feel like
They,
they were all that.
yeah, what we did, or what you did the last time is you took various blocks of money and invested them at various maturity dates.
I mean, I agree. 12 months seems like it would be the ideal length to reinvest that.
I'll second. Oh, that wasn't a motion.
I agree.
I'll make a motion for discussion purposes that we reinvest the treasury note expiring on 2/15/2025 for 12 months.
Second.
I have a motion and a second to extend this, or yes, is it extend? What's the term?
No, you're
Renew.
actually renewing with the notes. They do mature.
Okay, so there's a motion and a second in front of us to renew the US Treasury note. Any further discussion?
I believe this was for 3 different renewals, not just May, or not just February.
Well,
Otherwise, we wouldn't have all of the information in front of us.
actually, Miss Laurie, that was going to be part 2 of this. Now you have said that each time these come up to renew, you want to be able to review them yourself. The reason that was placed on the agenda that way is the question to you is do you still want to do that? Because you do have some others that will soon be maturing. If you wish to review them yourself, we'll be glad to put them on an agenda just as we did February's. If not, then you can direct staff to do it, but that's totally your call.
From what I can see on the report, we might as well just do all 3 months together.
My only issue with that is we don't know what those rates will be. I mean, I hope that they're close, but we
Yeah.
don't know. Maybe we might get a better CD rate at that point.
I agree.
I mean, I guess we could say as long as it's above CD rates and the current rate, then we'll do it. But I think we might as well just look at it every time.
Just do it as they come. So we'd see it again in May and then again in July.
Yes.
Okay.
Yeah, you're gonna,
thought.
we have no choice but to put them on an agenda and let you review them until you direct otherwise.
But you have your current rates there.
But it'll
Right,
likely
that's the thing is
change.
it might change. They might
But if
offer.
you could say if it goes up or remains current, and maybe we wouldn't have to bring it up again.
True.
Only if there's a decrease in interest, bring it up.
I just hit it every time. That's me. If you're asking for
Whatever.
the chairman's opinion, I'm just gonna hit it every time. Cause we can vote on them. I guess we have a motion in front of us now to approve it.
Yeah.
But I don't know. Any other comments or discussion on that before I push the motion forward? Okay. But, all right, so there is a motion and a second to renew the US Treasury note for the 2/15 date, renew it for another 12 months. All those in favor say aye.
Aye.
And that motion passes. And we can do a motion if you want to do a motion to, right? Can't we do that? We would do a motion to do the rest of them or to
I think the only ones you got on your agenda are May and July.
just May and July, right?
That's it.
Okay. It's up to you, but before I finish discussion.
No, nobody else is interested.
Okay.
We will vote on all of
I
it.
didn't want you to feel.
We will take 15 minutes every time.
I know, but I love being around you guys.
Yeah.
Anything else on that issue, Dale?
No, sir.
All right, so. Scratch that one off. On the unfinished Williamsdale, the first one, discussion of possible action for the general liability. policy.
Yeah, at the prior meeting, I advised the trustees that we had received a letter from our general liability insurance carrier advising that they had made a mistake and that they were wanting to go back, pick up the mistake and balance bill the authority. I found mistakes on what they were trying to balance bill for. So I was working on correcting those. And then, of course, after the last special meeting, we started transferring ownership of properties and or discussing transferring ownership of properties. And so I don't really know any other way to say it. It just makes sense to me to try and delay until we get this behind us. Because if we don't, we're just gonna be continuously correcting, adding and deleting off of our general liability policy. So, this is my way of delaying. I don't know how else to say it. I just don't think it makes sense to do any different. If I get under too much pressure from the insurance company, I'll put it back on the agenda and tell you so, but I'd like to wait until you've made your decisions and then just correct it all at one time.
Yeah, because we make a decision right now, we can change that decision
Easy.
right here
Yeah.
now, that is tonight. I agree. Mr. Beal?
I mean. Yeah, I would vote to do nothing anyways. It's not our fault. They didn't bill us. I don't.
By consensus, we don't need a motion to do nothing, right?
Right.
We can just.
But we have general liability.
Yes,
It's
I
in
mean-
blanket, right? It's, we have the coverage, we just haven't deducted the
That's right.
properties that we're transferring.
Yeah, we have full coverage. They're just saying, hey, back here 2 years ago, we failed to include in the premium these buildings. And that's partially true, but partially not true. And so we were in the process of correcting all of that. But then our agenda started carrying us to where we were making even more changes related to the property. And I just said, hey, if I can delay, I want to delay and just do it at one time.
sounds like.
That's our middle name. I like it.
There's more stuff down there. We'll get some more.
This
stuff
is for a good reason.
It's very good, yeah, it's
Trustee.
a strategic delay. So, before I close that, nobody's marked it on the public comments, but is there any more discussion amongst us on that issue? Okay. We'll agree to strategically delay. The next item there, discussion and possible action for, community health needs assessment.
Yeah, as trustees will remember, you authorized a request for proposals to do a community health needs assessment. I'll let Mr. Bill speak for himself because he was the proposer of this, but I think the idea was to try to find out what the public sentiment and all was as it related to things like the lack of, obstetric services. We hear every day that we need another ER in the community, those kinds of things. So we put an RFP out. There was 6 responses. Of the 6, 4 were found to be non-responsive for different reasons. And I included the sheet where those were logged in, where you would understand and know why that was. So it left 2 proposals, and of the 2 proposals, Sonia and I reviewed them. Obviously, we have no experience with either company. I personally think either company could do this job. There's no reason for me to believe different, looking at the proposals they submitted. But I did find some small differences that, at least in my opinion, made me think that the Health Management Associates proposal is the one that we should, or that you should approve if you decide you're going through with this process. Now, what this means at this point is a contract would have to be negotiated and brought back to you. This is not a final authorization at this point to do anything. I do think, though, that we're far enough along that to do this type of health needs assessment, I think your budget is going to be somewhere just south of $90,000 or somewhere just north of maybe 60, somewhere in there. So, if you were interested in what you think this may cost, I think that's your budget, 60 to 90. But you won't know until we talk about what we can provide that they don't have to duplicate, whether we can take some of the methodology and cut some of the corners because they've already been done, that type of thing. So, I'll be glad to answer any questions you may have.
Before we do questions, there's public comments on this, guys. Ms. Lindley, we'll put you up first.
Thank you, Chairman Douglas. Well, Florida that was their think is to decide what is needed. There was no response from them before you guys commit yourself to $60,000 or $90,000 at some point in time. I think, well, Florida needs to be contacted. And I think we pretty much know what the community needs without expending any dollars. So we don't need to proceed further with that. Contact Well Florida and see what they think. Thank you.
Thank you, Ms. Lindley. Mr. Lilker.
Thank you, Mr. Chairman. Stu Welker. I live 6.5 miles from the thriving metropolis of Fort White in Commissioner Ford's district. I just wrote 3 little things here. I'm not exactly sure why you wouldn't consider the other ones, considering every time this authority board has considered RFPs or responses to RFPs, it didn't make a difference what the RFP said. You know, luckily, the judge in Columbia County wasn't ruling on these. You accepted every one, whether they were emailed, walked in, sent in by carrier pigeon, thrown in through the window. It didn't make a difference. Didn't make a difference if they were on time or if they were late. You considered every one. So you have the information from the other ones, and some of them are just technical violations. In other words, I guess maybe electronically presented instead of in a hard copy. So clearly it would make sense that you would look at those following the practice and policies regarding RFPs that you've done before. As far as what Florida goes, for some reason, and it's impossible to see now, for some reason, there's a tsunami between the health department and Well Florida. I'm not sure why, but there is. But if you look at the health department website, you can find out all these needs and assessments that they have posted online. I believe that's correct. And you can go to Well Florida and get those too. So this would be just another waste of the board's money. I don't know why. Well, Florida did not respond, but clearly they are the experts as far as the health needs in rural Florida and Columbia County. I mean, they did a whole study on Columbia County. And the third thing is, I believe HMA, when I read that, it was a choice whether to get opinions from the public or not. And you see that Mr. Williams is shaking his head, yes, authority manager. And if you're gonna do this, and don't want to get opinions from the public, and Mr. Williams just said, we want to see what the public sentiment is, how could you agree to a study that doesn't study the public sentiment? Because part of that plan is not to get public sentiment, to save money. So I would just ask, if you haven't read that, you should read it. And if you haven't read it, maybe you should table it. Thank you very much, Mr. Chairman.
Thank you, Mr. Lilker. Anyone else on this list? Okay. Now, any comments from the board?
The reason that I originally brought this up is I think that there are needs, and I believe, like Mr. Lilker said earlier, whenever he spoke to the senator's staff, said that there wasn't a community health needs assessment. But we've got Well Florida, we've got the one on the health department's website. I think it's important for us to do one outside of what the state does. I'm familiar with the Well Florida one, which also said that mental health was the #1 issue in Columbia County. So to me, this would help us identify, is it primary care? Is it imaging? Is it an emergency room? Is it orthopedic services? You know, what is needed? What are the community needs? What does the landscape of healthcare look like in Columbia County? And how can we help meet those needs specifically for the indigent population? So. That's all I've got to say about it.
Dale, they give you a time frame?
No, well, to complete it, yeah, there is a time frame. I think realistically, if it was approved about this time, it would be through around August, something like that.
Please.
I don't believe that we have had good responses to any surveys we put out. I mean, number wise. Okay. Maybe an organized company could do that better than we do. But I think if you walk around and you talk to the people, you might get a better idea. In January, our one emergency room had people sitting in the waiting room for anywhere from 5 to 10 hours before they were admitted for treatment. And once they were admitted, they were not released to go to a bed or anything like that. They were kept in the emergency room, some of them returning to the waiting room, and released from the hospital anywhere from 18 to 24 hours later. That's tragedy. I don't care where you are. And I don't care whether somebody can pay for it or not. That's unacceptable. Now, that is one instance just recently in our county. What can we do to help alleviate that? Yeah, we need some emergency room care. We don't need it at one facility. And we don't need it at one location. Where else in the county do we have emergency room care? Why don't you talk to the people that live in those areas and see how they feel about it? Why do you think everybody goes to Gainesville? Because they can get treated. We don't offer that. Except over a long, long period of time. And if you've got the right insurance. That's terrible. And it isn't only emergency room care. Again, I will say about obstetrics. It isn't just people in Columbia County with obstetrics. If we could figure out a way to set up an obstetrics unit, we could partner with some of our surrounding counties. I'm sure they would be more than willing to have the babies born closer to home. I don't know that we need to have another survey done. We know what the problems are. We're not addressing them. Fort White could use an emergency room. Emergency care. Things to think about, people. Those are things we know. We don't have to get a survey for.
Out of curiosity, just listening to you talk, I'm just making sure that's what you're saying is a survey different than this survey. Than what they would prefer.
Probably.
up?
Because
We can't hear y'all out here talking.
Oh,
Y'all
I'm
really
sorry.
need the microphone.
Yeah, what I said was, I was just curious, basically, was, that survey she's requesting, that's different than the survey that Mr. Gill's talking about in this.
I'm not requesting a survey.
Okay, I'm sorry.
I'm saying, why are we paying for a survey?
Yeah.
When we already know where many of the problems are.
This isn't a survey where they just send something out in the mailboxes and ask for responses. They have community meetings, they get input, they look at data, they look at services provided, they look at, I mean, going through the packet, you know, the agenda packet that's got everything in it, their responses in there, and I mean, it's a very detailed response, and it's got a timeline. You know, theoretically, if it would start in March, it would go through September. But I mean, they're gonna disseminate and analyze at least 300 surveys, conduct and analyze 6 focus groups in person, conduct and analyze 8 key informant interviews, virtually quantitative analysis of secondary data, develop 6 GIS maps, develop an interactive dashboard. You know, I mean, there's a lot that they're going to be doing. It's not just sending out a survey to mailboxes and with a prepaid return envelope. This is going to be an in-depth, more than what Well Florida does, more than what it would be specific to Columbia County. I mean, it has in here. See if I can find it. Primary research data collection tools, including community survey, focus group guides, and key informant guide. Secondary research indicators to benchmark at the county, state, and national levels. So countywide, they'll be looking at demographics, socioeconomic status, mortality rates, and chronic disease prevalence, maternal and infant health indicators, access to mental health care, primary care, specialty care, and dental care, health behaviors, environmental risk factors. I mean, it goes on. I mean, I could sit here for an hour and read the entire thing. I mean, I don't know if we need to table it and discuss it, you know, when everybody has the opportunity to read through. The one proposal is, I believe, 14, excuse me, 21 pages.
Brandon, I'm not doubting that they have the ability to do all that. What I'm saying is we know what the problems are. Why aren't we taking care of them? If your car runs out of gas, you don't take it to the dealership to have a whole workup done to figure out what was wrong. You get the gas and you go ahead. And that's what I'm seeing that we've been doing. We know what the problems are and have done nothing. Except talk about how we're going to do surveys and other stuff and how we're not going to do things. Isn't it about time we started actually taking care of the people that we're taxing? Because
To
we
be
all
clear, we're not
vote.
taxing anybody. I want to
We
remind
all
everybody we're
vote
not taxing
on
anybody.
a tax. Think about it.
I'm with you.
Okay. Now, we think we're really great because we've only put a minimum tax out there. Let's all pat ourselves on the back. But we also haven't done jack about anything else. Isn't it about time, people? Every time we get proposals, we start in and we go nowhere. Let's address the problems we know about.
So what are you suggesting?
That we don't need a survey
Okay, so you're
because we
against,
already know the problems.
okay,
Let's do something about them.
Mr. Katie? Fuller, any thoughts on the survey?
Yeah, and until I have time to review this and see what services are offered by private, I mean, public entities, I would say no right now on this. Just, to me, that would be a waste of money, so. That's just my opinion on it. Now, I mean, I might change my mind once I read through it and see what the state offers, or if they offer anything, or, but if, right now, I would. Not the information that I have right now, not reading through it, I'm not at liberty to vote or say yea or nay.
Mr. Kennedy?
You gotta,
My thoughts are just, I don't think there's any harm in getting getting them to give us a hard number and a time frame. Time frame's I'm always looking at time frame. It's, what's the reality of it? Cause, again, with palms coming up and, all the other decisions in front of us, are we gonna get all the facts after we make all the decisions or before? I don't necessarily want to delay a whole bunch of stuff either, but that's the one thing I would agree to is I'd like to see how much they are gonna, put a dollar amount to it. Let us know what the real damage is, because I appreciate they have a proposal, but I was hoping for a number. That's my thoughts.
I've read it already. The whole proposal, and it's got some pros and cons. You're in the healthcare profession. You talk to people. I talk to people. We both agree. We need another emergency room here. Bad.
Yeah.
Especially from 6 PM to 6 AM. But I like this concept because they can work with the community. They can work with the health department, just like Mr. Ford bringing the thoughts, which I appreciate you bringing to give us, more additional thoughts in our mind on what we can do. But, the concept is good. I mean, I've got ideas, but then again, I'm not a professional in the healthcare and I don't know exactly what we need. You mentioned that we get proposals, we send RFPs, we've had proposals, we've vetted them, we voted them up and down. And unfortunately, we've only got one that's gonna be going in there soon, once we, get through another hurdle. But, I don't have any problems with this. I've read it. I like it. As it even says here in the one on the, community health needs assessment for health management associates, it says the survey responses will provide critical insights into health disparities and clusters of need across Columbia County. These findings will inform follow-up activities, including focus groups, recruitment, and mapping. And they will also include the Department of Health in Columbia County, Palms Medical Group, and other community-based organizations. And what better people to tell me what this county needs as far as its health needs. I like it. I think it's needed. I'm glad that the county brought this to us. Maybe the county, the city, the town of Fort White would help with the expense of it so that they can tell us their individual needs throughout the whole county. And Mr. Bullard, you mentioned some good ideas about getting Suwannee County and the other counties that maybe they too would want to participate, because we would benefit them down the road. So it's a small price to pay to help, in my opinion. Thank you, Mr. Chairman.
So. Right now, we don't have a motion in front of us to do anything with this item. Do we have a motion to do anything with this item? Can we just, out of curiosity, can I direct Dale, or can we as consensus direct Dale to get am I crazy? Is that the next step, is getting them to present a figure? Or is this it? And we know roughly the cost?
Well, they provided a figure in their response,
Okay.
but there are some things that if you're going to go through with this that need to be tweaked. Well, there are some things that I wouldn't suggest you just contract for because that was their suggestion.
Right.
There are some things you're gonna want to add to it, and there's some things you're gonna want to take away from it, is what I would suspect.
Mr. Chair.
Yes,
If
sir.
I may, just my opinion, maybe we reschedule this for the next meeting. Give everybody the opportunity to look through the proposals and do some research and then any kind of tweaking, and then we can decide whether we do it or we don't do it at the next meeting.
I'll second that.
Works for me. Okay.
May I make another suggestion?
Yes, ma'am.
Can we ask Dale to tap on the other counties and see if they would be interested in collaborating amongst all of us to get a broad spectrum for the area?
Like calling Hamilton County, just so I understand. You did like talking to Hamilton County and how their programs work and what their needs are, for
What,
instance?
if they would be interested in going into a survey with us,
Oh, okay, sharing the costs?
sharing costs, Hamilton, Baker, Swanee. Known as surrounding counties.
We certainly can,
We might get more definitive information that way. If you're gonna pay for it.
um. Okay, so. Specifically, like just this county and the surrounding counties, just contact the county health department, something specific? I'm just trying to give Dale direction, I wanna give him some,
I think Dale understands.
you good?
Oh, yeah.
Okay. I just wanna make sure, 'cause I
Yes,
apologize,
he's ready to pull his hair out. He understands.
okay,
Does the clerk understand who does the minutes? Cause I don't understand.
so we'll. It's fine, alright,
Chairman,
so we're gonna tell that,
health department would like to comment on that.
We've already done public comments.
we've done it, but I would like to, speak with you after.
I said, fine.
Yes, yes, I appreciate it. But we are, yeah, I'm trying to move it along, I got a
No,
pile of
okay.
stuff to go through. And we'll move on to the next item. Discussion and possible action, the approval of property distribution recommendation between Columbia County and Florida Gateway College. Mr. Williams.
Thank you, Mr. Chairman. At your special meeting in January, you requested that Columbia County and Florida Gateway College meet and determine between themselves what the best distribution of certain properties on the Lakeshore Hospital campus would be. I did attend that meeting. I was there to answer questions. The meeting went extremely smooth. I mean, I thought it was an excellent meeting from my point of view. It did not take them long. And included in the agenda packet on that page D2. I thought the best way to show and demonstrate what they talked about is by doing a color-coded map. What was decided and what they are recommending to you as trustees of the Lakeshore Hospital Authority is that the property in orange be distributed to Florida Gateway College. The property that is shown in pink or red, whatever your preference is, be distributed to Columbia County. And I went ahead on that same aerial and showed in yellow where the vacant lots were, which were just to the west of us. Those were not discussed, but I wanted to show where they were relative to these other properties. And so that was what they decided and they requested. And I'll answer any questions you may have. And obviously, there's a number of people here tonight that were present at the meeting.
Okay. So before we do some discussion here, I know there's a number of folks out there, Mr. Foreman, you turned yours in first. I'd love to hear from you.
I'll be as entertaining as I can possibly be. And first and foremost, I want to commend Mr. Williams, represents the college. I was not able to personally attend the meeting, but I got briefed before and after. You guys are playing how that works. Joel Foreman, Columbia County Attorney, for the record. The proposal, as indicated, is something that the parties agreed to. You guys asked us to sit down and work on it. We did. The food for thought I wanted to leave y'all with, and again, hope you will approve this. I think it's a wonderful step forward for the authority and for the county and for the college, obviously. The health department building, you can't see this, but I'm gonna point to it anyway. That's ours, that's the county. You go to the west, there's another parking lot, that's the county. So as you bleed past Calhoun to the west, sort of start to see where it would be a really nice public purpose campus for the county if we could get all that property contiguous. These properties aren't at issue. I do know y'all have a mediation coming up where these properties might be at issue. By the way, if you transfer these properties to us and want us to go to that mediation, just let me know. Just have to reach me. But food for thought, just as you get further down the line, you know, we're trying to do long-term strategy, long-term planning, and this just looks like a great public purpose campus if we get further along to go all the way from the hospital all the way out to Marion. What would have one day been a health corridor, obviously those issues are kind of falling by the wayside, but it could still be a great public purpose corridor to serve the city, the county, and all of our other agencies that we talked about last time I was here. So again, I want to thank Mr. Williams. Thank you guys for having the vision, and I hope you will.
Thank you, Mr. Foreman. Mr. Welker, I know you circled this, or let's do it.
Thank you very much, Mr. Chairman. Stu Welker, 6.5 miles south of the thriving metropolis of Fort Wayne. I'm opposed to this in part. I did contact the tax collector 2 weeks ago. Still waiting for a response, and he was gonna run the numbers on what Columbia County residents pay to the hospital authority in taxes to the hospital authority, and what Columbia County residents paid to the hospital authority in taxes. I respectfully point out to this board that my friend Dr. Barrett and the college paid nothing in taxes to the LSHA Hospital Authority. You see Mr. Barrett is there shaking his head yes. Just like Palms Medical paid nothing to the hospital authority in taxes. Being that the taxpayers of Columbia County and Lake City have paid for everything on this campus, and the money that is sitting in all the accounts of the authority belongs to the residents of the special taxing district known as the Lakeshore Hospital Authority. I would ask you to consider this, that the first thing that this authority should be responsive to is the people that own the assets of the hospital authority and paid into the hospital authority since whatever, 1950, 2000, pick your poison. It's now 20 clients in the hospital authority. A disgrace. 20, and we're all going for this, 20 clients after the residents of Columbia County voted in a non-binding referendum to get rid of you guys. And here we are discussing, well, how are we gonna spend money, this, that, and the other way. But I would say if the county or the city needs the property or can use the property, that the taxpayers of the county and the city, both municipal corporations, like pay you guys, those taxpayers, can use that property, they should get the first chance at that property, not the college or anybody else. And this has nothing to do with the college. They have their own property and their own accounts. So I would respectfully ask you to consider that. Thank you very much, Mr. Chairman.
Mr. Welker. Want to check and see if there's any other comments floating out there? No? Okay. Huh? Oh, did you? Oh, yeah.
I didn't mean to skip you. That's all.
I'll forgive the resident archaeologist because you're still digging. For people that don't know, years ago, our chairman called the main building a dinosaur, so he became the resident archaeologist. As I stated before, I couldn't see that. I forgot to bring my map. But what is the history? What would be done with this building? In your
County before that.
I don't know. Actually, I was gonna ask that question in our discussion.
Okay, then you ask the question, I'll get an answer.
There you go.
Any more public comments?
I'll be happy to address that when y'all are questioning.
I was gonna say,
We did have some discussions about it, so I'll be happy to talk about it if you guys have any questions.
okay. So beyond that, any other further questions before we start discussions? So, thoughts from the board? Be happy to start.
I'll start. I'm in favor of basically doing everything that's listed here, except for, I think we should hold on to the parking lot that's just east of us currently for right now until we figure out what we're doing with the PT building.
Okay. Mr. Foreman, who was getting what? Just so I'm 100% clear.
Yep.
I was not privy to it. So. What were the hopes and dreams? Start with the women's center by the lake, if you wouldn't mind.
Okay, that's gonna go to the college, as Dr. Barrett had explained to you guys at the last meeting. They
Yeah.
have vision for how they're gonna use that as a teaching facility. And they like the way it's oriented, and you, as you indicated, they don't have to give up the medical improvements there, they can actually use them, so it made a lot of sense. This building, there was some question, and I think it's my fault, about who was gonna come here. And I sort of made the point, well, we got all kinds of options, if we have enough square footage, we can move all sorts of people around. Court administration's gonna come here. Okay, that first and foremost, the entire impetus of this was to find more square footage for court administration. They will have first dibs. That's from the county manager's mouth. He would have been here to say it himself, but I think he's on. Yeah, he's on vacation. So, but no, absolutely. We also understood and continue to understand that court administration is very happy with this building. And they would very much like to use this building. So that's the plan. I talked to Mr. Kennan. There was some indication, would we be willing to sign an agreement to that effect? Absolutely. Mr. Kennan and I can work up a purchase and sale type agreement where we can put binding obligations like that in there. I would suggest they have a certain shelf life. Yes, sir.
Joe, I was just gonna bring up the parking lot.
Mhm.
It was discussed that, I know you wasn't there, so I just have you. It was discussed at the meeting that it would be a multi-use parking lot, but the county would take over the maintenance of the parking lot, so that's why it would go to the county.
Yeah, and I think, thank you for bringing that up. That it was more, Mr. Bill, the inclusion of that was to put the onus for maintenance on the county. It would be a public parking lot, so I think it would be usable for everybody around here. Was that also your understanding, Dr. Barrett?
was.
Yeah, it would be like a general purpose parking lot that we'd be responsible for.
So if I may,
Yeah, please.
actually I have two questions. So
Come on.
Meridian or a possible some other end user of the PT building, that parking lot would be open to the public.
Yes, sir.
If I wanna-
Public parking sort of akin to across from Marion Street. Whoever needs to park there can park there.
I want to come
That's
have
the
a
vision.
picnic on the sidewalk. I could do so.
Because it's central to the campus, so the idea was, but I think, and Mr. Williams, I don't know if this came from you or not, but I mean, somebody's got to maintain it. And it makes the most sense for the county too, since we're gonna have so much acreage down here.
Well, simply put, I was asked the question, what I thought about that being transferred to the county, and my response was, look, as long as you're gonna keep the same intended use, and you're gonna pay for the maintenance, why wouldn't you do that?
Sense. If I may, Mr. Chair, my
Please.
second question.
Please.
And Dr. Barrett, this would go for you as well. You're both probably aware that we're currently going to be going to a conflict resolution with the city of Lake City. Would there be any objection to us saying, here you go, as is? You may or may not have the proper zoning.
Yes, sir. And I think it's understood that it would be as is. To the extent this happens tonight, I can tell you right now, my next call was gonna be to Todd tomorrow, like, what can we do so that we can get in there and participate? Again, the properties that you're going to retain, certainly understand that you're gonna retain them. But again, I think the city would probably have designs on those properties, and I know for a fact the county would have designs on those properties. Again, this is for 20-year out planning. if this does in fact become the new home to local government. So we'd like to be at that mediation table, assuming this goes through tonight. And the college, quite frankly, may want to be at that mediation table to understand what's going on down there. Whether or not they add anything or take anything away, they may still want to know. And my understanding from Mr. Martin, city attorney, is that the city would like for as many people to be in there as possible. So the primary litigants will control that, but certainly if we have some of this real estate, we want to make sure we're in there.
Dr. Baird, I'm not asking if you want to join or not, but would you be interested in? Would you be
Lawrence Barrett, president of Florida Gateway College. I have no intention of indicating to do mediation with the city of Lake City. I don't want anything to do with city of Lake City. I want to get this thing done today. We'd like to get it done from a man of action. Our college is a man of action. And to answer a question about taxpayers, we've never charged taxpayer. Our college is funded by taxpayer, but we don't charge any taxes. So we're the only entity here tonight that doesn't charge the residents of Columbia County taxes. So that's all I have to say. I want nothing to do with mediation. And I believe we're going to move ahead.
So,
And we would take it tonight and we wouldn't care about it. Thank you very much.
thank you.
My apologies.
My two thoughts on it were, one, that if we gave them the properties, they would be as is, and if they have zoning issues, they deal with their own zoning issues with the city or themselves or whatever. And then number two, as part of any motion that may be forthcoming, I'd ask that in that motion, that you authorize myself and Mr. Williams to determine, which of these properties, which would be probably most of them, need to go ahead and have authorization to have them surveyed. Because some of these properties are included hypothetically block 9 of the city. There might be, the parking lot might be in 9, or half the parking lot's in 9, the other half of the parking lot's in 10. And that way, I think the only way we can, get a clean line, is to have a meets and bounds survey on what we're going to convey to them.
Okay.
And we can negotiate with them on potential splitting costs, or however the trustees want to do that.
My next question, who's gonna pay for that?
Recipient or the provider?
I thought we voted last 2 weeks ago that the recipient. Was I crazy for thinking that?
No, it's kicking around mine too. I can't think of it.
Mr. Chair, y'all did vote for that.
I think
Yeah.
if you were giving it to them, they should pay for survey. We shouldn't pay for that.
And again, Mr. Chair, in terms of the county's policies, whenever we've handled a donation, we've always understood that we're going to carry those closing costs,
Yeah,
including
We
certain
did.
costs and things like that.
that's what triggered it, was closing.
As long as it's a donation, we cover that.
Okay.
I'm assuming the college would be the same
Same thing
way
we
to
do
make
that
sure
for
that
all
we
our
get you a meets and bounds of exactly what that building
We would hire
entails.
a surveyor to take care of.
Okay.
And we'd have done in 30 days.
Okay. Yeah. I'm sorry, Mr. Kennedy.
I guess, I only have 2 questions. And it would be for Mr. Foreman as well as Dr. Barrett. And I don't know whether you can answer this question, Mr. Foreman, but I would like to see these buildings occupied and occupied quickly. And I know that the sole purpose was for us to get court administration in here. Do you believe that the county administration can make that happen within the 6-month period, which I believe court administration can break their lease within either 4 or 6 months with their current provider?
It's my understanding from talking to folks in court administration that they can break their lease. They specifically negotiated the extension to allow for that should something like this occur. It's also my understanding that the improvements to this building mostly just include partition walls. So I don't see there being any barrier. I think 6 months is a very reasonable.
Would the county mind if that is placed in the agreement with you and Mr. Kennett? And then likewise for the college, Dr. Barrett, as far as occupying And I know in your presentation that you gave to us a few months ago, you had stated, I think, the first floor, we're looking at August of 25, and then the second floor, August or September of 26. Good.
January of 26.
January 26.
It
Oh,
would
wow.
depend upon, once again, as we know, we're gonna have to look at probably significant upgrades in HVAC systems.
Yes, sir.
And finding resources in this upcoming budget to figure out how to do that.
So
But depending on what we need to do, I would say we want to get this done as soon as possible.
Okay.
Also from a programmatic standpoint, because those two programs have some accreditation issues, that will take 6 months to 9 months on a fast track. So
But as far as you know, would your legal staff have any problems in getting with Mr. Kinnon on that to have that written into the contract? And then for both of you, I assume, like we did with Meridian with Mr. Kinnon in the contract, there's a reverter clause at the end of 30 years, after 30 years, or excuse me, during 30 years, if it's not used for the intended purposes, it would revert back to the hospital authority or its successors. Would there be any issue with that,
no, we're not.
Mr. Foreman?
Yeah, reversionary clauses are also very common in donations.
Okay,
So, yeah, if that's something that the authority's interested in having, I don't think.
and I only said 2 questions, but it's been about 5, so this is my second one. As far as the county goes, do you see any problem with our only 2 staff members occupying the current end of the building where they're at until who knows, to be determined, let's say that.
I think I probably have to discuss that with those folks back there, Mr. Bennett. To be fair.
Okay.
I don't know.
Yeah, because it's just
Do you know
2
what your plans are
employees.
for this building? Sure. He's asking, is there gonna be an opportunity for their folks to stay in this building?
We only have,
Move in
Okay, that's your answer.
say that again?
until
Until
we move in.
Ooh,
I call that a hard no.
I'd call that a hard no.
that
In no place of this building, this building couldn't occupy 2 employees, meaning a part-time employee and a full-time employee. One of them's part-time.
We need to Chuck Heideman's on the court administrator. Until we get a good space design of this, I really can't answer.
I got you.
But
I
if it
figured
was the footprint of what I understand, I would say, I would hesitate on the side of no, but I don't want to say that that's definitive because we really have to measure all of the space and then figure out who's gonna go where.
What, Mr. Foreman, as far as, oh, excuse me, Judge, I'm sorry, go ahead. Yeah, I'm in too, yes.
Good afternoon, Melissa Owen, Chief Judge of the Third Judicial Circuit. The reason for the hesitation with co-occupying in a building is that we deal with some very sensitive information.
Correct.
That we have to be able to say, no ifs, ands, or buts. People don't have access to it.
I got it.
So that's one of the.
I didn't
reasons for
think of that,
hesitation.
but you're absolutely right. Mr. Foreman, as far as this building back here, which is currently being occupied by the clerk of court, if we, the authority, were able to provide, because it's climate controlled space for our 2 employees, would that be a possibility?
It would probably be fine, Mr. Kennedy. I will tell you, we're building our inventory of space under roofs. And if you're looking for a place to locate your folks for some in-room arrangement or even something a little bit more long-term, I don't really think that would be a problem for the county. We have the old Lake City Reporter building that's being renovated. We've got this building back here. As I told y'all at the last meeting, our objective, because we do have to provide roofs over so many different agencies and offices, is to maximize that portfolio, which is what this building would help us do.
Gotcha.
So it'll free up other opportunities. Hopefully things we're not paying rent for, things that we own, which is again, in the interest of the taxpayer. So if you're worried about location for your folks, again, you're donating this property to us, I'm sure the county will find a way to make sure you're.
Right. With hopefully the same lease provided for this building back here by us. Yeah, I had to throw that in, Mr. Foreman, I'm sorry.
$100 a year.
And they pay the utility, we pay the utilities. That's all.
All right, Ms. Chancey, anything? Okay. Think it there. I don't know, is there any fancy way to word that in? Any way to word that lease, or do we just approach that as we're building the lease agreement?
It would be if you could have a motion to convey the buildings as proposed. Subject to a finalization of negotiations as to closing costs, timeframes, et cetera. And then Mr. Foreman and I will start working on that. And that way you have those contingencies that have to be resolved before there's a final deed is probably the easiest way to say it.
And
I'd call it like alternative lease space for
And I-
authority staff.
I assume you would be working with Ms. Logan also,
Correct.
with the college.
Okay.
I'll second that.
No, I'm lost. Like, wait, I can't do that.
You can't
Yeah, we
make-
gotta have a.
can't
I know that.
I can't. Sorry,
Yeah.
a lot of action. So do we have any motions? Board or?
Yes, Mr. Chairman, I'll like to make the motion, based on our discussions here tonight that, we approve, the property distribution, between Columbia County and Florida Gateway College. And if you want to attach to the motion, the map, I guess that's so provided by Mr. Williams, showing the actual positions, or excuse me, which building goes to which entity, and also, direct Mr. Kennan to get with both legal staff of the county and legal staff of the college to finalize the
Terms and conditions of the
terms and
transfer.
condition. Thank you. Terms and condition of the transfer, period.
Okay.
I'll second it.
All right, there's a motion and second, in front of the board to transfer the, we're gonna call it the parcels as described in D2. Let's do a roll call vote just in case. Ms. Chansey,
Yes,
Yes.
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 motion passes unanimously. All right. Let's see, we're gonna move on to the next item, discussion of possible action to termination of Columbia EMS lease officer, Mr. Williams.
Yes, just to remind the trustees at our last meeting, you asked that I reach out to Columbia EMS to see if they still had continued interest in the building, which is located at the northeast corner of the hospital campus, for the purposes of a EMS, substation. And I had a nice discussion with, Mr. Witt. At the end of the day, Mr. Witt said that it did not look like they would be able to proceed with that request. There was a lot of discussion about cost of renovation and time, versus what their immediate need was. And so with their permission, I'm advising you that the offer that was made to them can be rescinded. And that property was, just to remind you also, that property was not included in the conveyance to Meridian. So it is an available building on the northeast corner of the campus. But I would like for you to have a motion that you are rescinding the offer, and at least we can make it official, and I'll send him notification.
Just in case before we do discussion, are there any public comments on this? Suddenly,
Thank you. Now that that will return to us, that could be a place the authority office goes. You know, and Sonia could go there. There's plenty of parking, probably a minimal expense to do that. So I think that's a place where you guys could go. Thank you.
yeah, and Mr. Love. Have we exhausted public comments on this? Perfect. Discussion of the board.
Fair.
Yes, sir.
Has that property been deemed surplus?
I think so.
No.
I don't think so. It wasn't in the original one, yeah. It's not.
We excluded it.
I mean, I don't know.
We can't not do that tonight either, can we?
Put it on the agenda.
Put it on the,
I would like to see if there's any interest from Meridian or whoever. I mean, it's next to them. I mean, I also like Miss Lindley's idea. It might be a good temporary spot as well, but
On that, with the temporary spot, just out of thoughts, but if we're cutting the deal with the county and the county's gonna give us free room and board. I like the free price.
Yeah.
I don't necessarily want Dale to work out of his pickup truck to do this, and so,
but I think it would take quite a bit to renovate that,
yeah.
building. Almost said barn. But I agree with Mr. Beal. I'd like to see if there's interest either from the county or the college or the city. Well, we haven't heard from the city. We've been begging them to come and speak to us.
Meridian.
Or Meridian.
Or
excuse me.
Meridian,
Yes,
yeah,
or
if they
Meridian.
have a
Absolutely.
want or a need
Yes.
for it,
Yep.
yeah.
If I may, Mr. Chairman,
Yes,
just
sir.
to remind the trustees, this is taking into considerations the decisions you've made tonight. You now have that building that we've just discussing. There are two small lots beside it that that have been declared as surplus, but nothing has been done with them because they were going with this property we just discussed. There is the 11-acre lot, the furthest eastern piece we have, which is accessed off of Lake Drive. It has not been declared as surplus and is there available. And you have the lots which are to the west of us, which are the ones that were shown in yellow. So those are the properties that are now left, just to make sure you understand.
Are there any turkeys on that 11 acres?
Yeah, lots of them, but you can't get to them.
For chair.
Go ahead.
I was just gonna say, I would like to see at our next meeting, that building, the 2 lots and the 11 acres. For discussion to be listed as surplus.
Mr. Fuller.
Get a motion to make a motion to take Columbia EMS out of this building and, put it toward surplus.
Second.
Chancey, I want to touch base with you before we, just in case you had any comments. We were all just jiving back and forth. Anyway, all right, there's a motion, a motion on the floor and a second to remove EMSs from their lease. That is just the motion, right? We can't declare it surplus.
Correct.
Okay, so there's a motion to remove them from their lease. All those in favor say aye.
Aye.
All right, motion passes. Before we move on, do we want to have Dale put it on their surplus?
I think that was.
I think that was, yeah.
That does it?
I think that was Mr. Bullard.
Okay,
Put it on the next meeting
Next
agenda.
all right. I'm sorry, I misunderstood.
And the only reason it wasn't is we still had an agreement with those folks. Is
Yeah.
Yeah.
Okay,
that correct, Dale?
That's correct.
so that item's cleared out. Unless anybody has any further discussion, I'm gonna move on to unfinished business, the chapter 164 of the non-conforming zoning determination, Mr. Kim.
March 12th, 1 o'clock, City Hall. The advertised will be in the process between then and now of coordinating with, I guess hopefully the county now too, but coming up with, procedures, on how that meeting will be run.
You said 1 PM.
I think it's 1 PM.
You said that'll be advertised. This is open to the public.
Public meeting,
Are
yes.
trustees, capable of attending the meeting?
It's a good question.
I'll have to check, but I mean, we have a representative that'll be, handling it, for the trustees as a whole, but if it's a public meeting, I don't think there's any prohibition to anybody coming. But we'll get a meeting together between the attorneys to get, when we do public comment, those kind of things, how we're gonna run it.
Just a matter of housekeeping. Through your office and through Mr. Arline's office, we were asked, we, the authority, was asked to run the public notice just as we would run any special meeting notice.
Right.
And we've taken care of that. But what goes with that is an agenda that we publish. I have no idea what to put on that agenda. I don't know whether there will be, I'm sure that there's some established rules for these hearings. There'll be maybe an opening comment by the city, an opening comment by the authority. I don't know. But I need y'all to help us put the agenda together.
Yeah, we're in the process of scheduling a meeting with myself, Mr. Arline and Mr. Martin with the city, and then obviously if the county's gonna come in, get input from Mr. Foreman. But yeah, that's next to work on as far as how the order that meeting's gonna go.
Well, just to remind you now, we're going to need that agenda about Thursday of this week.
That's gonna be difficult.
For the March 12th, maybe?
Before we get too lost in the discussion, there are some public comments. Mr. Barrett.
Thank you, Mr. Chair. I would just like a point of clarification, and I know this is public comment. I'm not sure why the town would be involved in mediation, since they're not taking over the property. That would be my question.
I think it's guilt by association from the transfer we just.
I don't think that's what the point of that is, but just my recommendation, I'm not a legal counsel. I think that would complicate the issue.
It's true.
And I think that would be very foolish to take on unless that's a legal opinion, or the college would then need to be involved with that. Thank you very much.
Sure. Mr. Loker, yes, you did the one out. Go for
Yeah,
it.
read there. Thank you very much, Mr. Chairman. I haven't moved since the last time I introduced myself. It's a long meeting.
It's a good joke.
I agree with Dr. Barrett and Mr. Bullard. Questions. It's a public meeting. There's been enough trouble already with the legal opinions that are thrown down between the city council and the hospital authority council and the ex-city council. If anybody read my story this week, this is a public meeting. That's why it has to be noticed. Anybody can attend. And there's attorney general opinions, there's court opinions. They can all attend. Mr. Kennedy can even attend and look up at the sky and do what he likes to do best. Anybody can attend. What you can't do is discuss stuff between yourselves on something that will foreseeably come before this board in the future. That's kind of ironclad. So I hope you guys all show up and have a good time. And I hope that answers your question. Thank you very much, Mr. Chairman.
Thank you, Mr. Loker. Any further public comment before we continue our discussion? All right.
Wait, can I clarify something, please? Yeah. The reason I'm saying Thursday is the ad is gonna run the 26th in the paper. And that averts to our agenda. So we would need an agenda up when that ad runs for that conflict meeting.
Well, I think what you're gonna have to do, Sonia, is simply put a filler in on the agenda, for the agenda. Just say it's not available and it's not expected to be available until, and then give them some date.
I think she's saying it's gonna be 16 days from now instead of 3 days from now, but.
Yeah, that's right, Brad.
Yeah.
I'll
She needs about the
as
26th.
quickly as we can get all three attorneys together, and I'll get an opinion on what the city, their timing is. I think they are going to actually broadcast it like they do their city meetings. So I'll get with Mr. Martin, tomorrow or Thursday.
Thank you, Brandon.
Any further discussion?
Yes, Mr. Kennan, is there any hope that between you and Mr. Arline, getting with Mr. Martin, that this can be resolved before the 12th with a 2 or 3 page legal document?
We can try, but probably not.
Okay. But I mean, but that's still an option.
I
that's
mean,
on the table.
the city could approach us and say, this is what we're willing to do, and obviously, as we've indicated, any final approval of anything, we have to come back before this board.
But we haven't approached the city as to whether they were willing to do that.
The city's only inclination is that they were willing to participate in the March 12th meeting, so that's all
it.
we've got here.
Okay, well, if they feel that way, I guess we do too.
Mr. Chair.
Yeah,
Um,
Mr. Beal, sorry.
as one individual trustee, I just would like to vocalize my opinion on this, that I would hope that our representative from the board, our attorney, as well as Mr. Arline and Mr. Williams, I would like to see that this one step be done in this one day. And whatever step 2 is, we don't have to reschedule for step 1, part 2, step 1, part 3. I'm very hopeful that step 1 will be completed on March 12th. And then we continue moving forward in the process, whatever that may be.
Certainly the hope.
And I too feel the same way, Mr. Beal. But I'll even go one step further. Do we want to discuss that if it doesn't, that we direct our legal staff, Mr. Kennan and Mr. Arline, to go ahead and file proceedings?
I think that we should.
I think we should attend the March 12th meeting and see what comes of it before we make any decisions. That is my recommendation.
And I agree with your recommendation, but then if that's the case, we're looking at April before our next meeting to get that word. So should we go ahead and set a special meeting in March?
I would like to.
Technically, we could just go
If I may.
Yeah, please.
One thing I had discussed with Mr. Williams would be to move the March 10th trustee meeting to the March 17th.
Not St. Patrick's Day.
Yeah.
How about the 19th?
We're green.
Wouldn't the 17th be the city's meeting? Can we have it the 17th?
Can't do that.
Oh.
That was a good one.
Wife's birthday too.
Can we do it?
Bring on. You've been here.
Can we do it on the 17th if the city has their regular meeting then? Or should we do the 19th?
I think we can, but I don't know whether you want to or not, but I do agree with Todd. I do think that we should cancel the meeting on the 10th. That way, when you come and you've got all these items on the agenda, you should have an answer and know how to resolve these.
Really rather.
What's that?
Tuesday, not 17.
Mr.
Well, then
Kennan,
why
what's
don't
your-
we go with
18th
Tuesday, the
is the
17th?
18th, the second Tuesday?
Third.
Third, okay. I have the city of Live Oak the second Tuesday of the month.
So the 18th would work. Third Tuesday.
Don't see why not.
Can we tentatively say the 18th or 19th that week? And just to confirm everybody's schedule?
I'm free. I can confirm it right now.
I am too, but.
Are both the dates good for all of you in case there's a conflict that comes up?
Yes.
Yes.
So the 18th or 19th.
They're all good with me.
And
But
as,
don't we have to advertise it as one date or the other?
yeah,
But that gives Mr. Kennan time to check his.
but everybody checks their calendar and Sonia calls to make sure there's no personal conflicts. We can set it up.
Okay, I'm good.
Of the two dates, which one is preferable?
Yeah.
Tuesday or Wednesday?
Dawn, you don't know?
No, here's my only problem with this. We're gonna meet on March the 12th. And then we're talking about 1, 2, 3, 4, 5 weeks that we have to wait to get back together.
We're not meeting on March 12th.
We're
That's the
moving
reason
it.
we're still
No,
moving
he's
it.
talking about the conflict
Yeah, I'm
meeting
talking
is
about-
March 12th.
Yes,
We're
okay,
canceling the regular board meeting in March.
okay, and we're gonna move it to
rescheduling
we're gonna move it to the 18th.
or 19th.
Okay,
Yeah, that way we're only 7
Which
days
one's
away
good for you?
from that conference.
that either day is good with me.
Okay, so do y'all want the 18th or 19th?
Don't matter, hey.
Let them go home and check with family, Sonia, and then you can
Yeah,
call them
I'll-
and go.
Call
Call everybody.
Alicia
Okay,
at 8 in the morning. She'll tell you that
Yeah,
both of them
yeah.
are probably
how about
good.
8:30?
That's fine. She'll be there at 7:30.
Perfect.
You don't want
I
to get up that
know,
early.
she calls me.
And that's what we'll do. We'll meet after the thing. Any other discussion on that? All right, on the next one, discussion and approval. Nope, that one's done. That one's been tabled. Hang on.
We're just-
We talk about the February 24th meetings.
I
That's
think
what we just
implicit
did.
in that we wouldn't need that.
Okay,
Yeah.
Handle everything
we
on
handled that.
post meeting after the 12th.
Your next meeting as of right now will be the 18th or 19th of March.
Okay,
Yes.
so that being said, staff reports in your packet, board member comments. That's it.
None.
Kennedy.
Done.
We did good, guys.
Oh, I'm sorry.
Oh, I'm kidding.
No, go ahead, go for it. Good.
I'm good, we're done.
Yeah.